nice to meet you here. During today's lecture, I want to briefly explain about the Australia's community aged care services. Now we know that Australia is a really good welfare country which provides a lot of support for elderly people, and older people can enjoy their life maximally. A lot of countries actually they don't offer community services. And when people get old, they have to rely on family members to look after them. However, in Australia, most elderly people can receive the free service from the government, and the service can be either offered in their home or in the community setting. So let's have an overall look about what kind of aged care services are available to choose. And the first one is called the Home and Community Care Service. In the short term is HACC. This service, this service helps the residents to maintain a good level of support at their home. So the staff working for HACC drive the car and visit clients in their home and then provide some home support. For example, they can help the clients to do like the housework, gardening, shopping. Also, they can help the clients with showering, with daily activities, with mobility. Also, they can help with the transportation. They can help the clients to go out, travel somewhere, do the shopping. Like a lot of different tasks. So HACC is really good for the elderly people who are over 65 years of age and lost ability to look after themselves. Now, another service is called the CACP, which is the Community Aged Care Package. Now, Community Aged Care Package is similar with this home care service. So it focuses on providing care to the elderly patients who are above 65 years of age. Again, now the staff working for CACP, they include the nurses, aged care worker, the personal care worker. Now these people, they have the professional knowledge about aging support. So they go to clients' home and help them to help them to provide like the hygiene care, help them to provide the nursing support, help them with also the daily activities, with movement, with meal preparation, with shopping, with transportation, all the kind of different care that they can offer. We have another service which is called the Meals on Wheels. Meals on Wheels, this service in Australia, now they normally prepare the meals and pack the meals, and then they drive the car and send the meals to the client's door. So it's very convenient for elderly people who cannot cook food for themselves. Normally volunteers or the staff work for this service. They drive the car and they will deliver the meals. And this service is not only suitable for elderly people, but they are also suitable for disabled people or people suffering from like long-term chronic health conditions. Another service is called the Respite Care. Respite Care focuses on helping the carer, the client's carer or the family members. So if the family member or the carer actually have been looking after the clients for a long time and they feel exhausted, they feel really tired, and they would need some holiday or rest. In this case, they could send the clients to this Respite Care to receive a temporary support. And then during this temporary period, this family member or the carer can take a relief, can have a relax, have a holiday. Now, these services are all the community services, which means they offer care to the clients at their home and give them some support, so the clients can still stay at their home. Now, so these community services normally offered to the clients who can still manage part of their personal activity, part of their personal daily activities. So patients who receive community service, they actually haven't lost the whole capacity to look after themselves. So they still have some ability to care about themselves. So so that's why these services can offer the home care. So they can drive to clients' home and provide certain some part of the care in their home, so they can still stay at home, enjoy their life. However, now if the clients become really weak, if they are really old, they are very fragile, they lost the whole capacity to live on their own, that they cannot manage any of their daily activities. Now, in this case, their family members could send the clients to this aged care facility. In another name is a nursing home. Nursing home is a whole facility in Australia which could provide permanent full care to the clients who lost the whole ability to care about themselves. So all these are the Australia's aged care services. Now we have a good understanding now. Now, before patients are admitted to this nursing home, because this is a permanent service and this is government funded, before patients is admitted, now they must do a health, they must do a assessment, and this assessment is called the aged care assessment. Now, so the aged care assessment team, which is called ACAT. Now, ACAT is a whole assessment team which work for the government. Now, this team include all these like professionals, like nurses, doctors, like different healthcare professionals. Now, they will visit the client's home and then conduct a full assessment for the client to assess their ability of looking after themselves, to assess their independence level, to assess how independent are the clients and how much care they can provide to themselves, and whether they are really weak, whether they lost the whole capacity, whether they needs to be admitted to the nursing home. So they will do the whole assessment, and then after the assessment is done by this assessment team, a plan will be made, and then they will refer the client either to this either to some like home care package or the permanent care support like a nursing home. So they will decide what kind of care the elderly patients really need depending on their level of independence. So this is called ACAT, Aged Care Assessment Team. Now, most communities aged care services and nursing home, most of these aged care services in Australia are government funded. So that means government pays a large proportion of the aged care service fee, and the clients only need to pay a small amount. However, it depends. The amount of the money that client needs to pay depending on their income and the financial situation. For patients who have like high income and high pension, now they will need to pay more money for the service. Now, for people who have like low income, low financial status, now they don't need to pay much. The government will support more money to them. So this is really important for us to know. And also, lastly, I want to introduce something called the ACFI, the Aged Care Funding Instrument. Aged Care Funding Instrument is a tool used by this nursing home, by the aged care facility, to assess the level of funding needed to look after the residents. So ACFI, so the nursing home, now after they admit a new elderly patients, they will need to use the ACFI, the funding instrument, to assess how much money is needed to look after this client, these elderly patients. And after assessment is done, they will calculate the amount of money that is needed to care for the resident and then send it to the government. The government will then provide the certain amount of money for the nursing home for them to look after the clients. So aged care funding instrument ACFI is used for the aged care facilities to assess how much money is needed to provide aging support to the clients. So I hope really this little lecture could help you to gain a better understanding about the Australia's aged care community services. Thank you for listening.